Hello friends, today's video is about a question asked by Dr. Akshita Fernandez about endometriosis, the conflict and approach towards endometriosis. I would like to put forward few points regarding this. So endometriosis is a situation where endometrial tissue or endometrium like cells are formed outside the uterus, most commonly in the fallopian tubes, in the ovaries, or tissues outside uterus and ovaries. Why? The question is why? The cause is unknown according to the other sciences, but in this endometriosis, there is certain conflict in the mind of the patient because of which this phenomena in the body happens. Now, what is this conflict which causes the endometrium to be formed in some other place outside the uterus? So, regarding this, there are few possibilities. If a patient of endometriosis comes, you can probe these possibilities so that you can find out the conflict and then you can form the rubrics. So, first possibility is when a female decides that I should not have the child in this negative environment because there are a lot of quarrels, there are a lot of problems going on at home between in-laws, husband, and so many things. So she wants to bear the child, but not here in this environment. Okay. The important thing is the female wants to bear the child, but not in this place, somewhere outside, so that I would be at peace. So because of that, this thought process, the endometrium is formed somewhere else, so as to comply to this thought process. Okay, first. Second possibility is if a female is having an extramarital affair and she wants to bear the child of some other man, then also the endometrium could be formed outside the uterus because the female is looking outside to some other person. Then third possibility is when the husband is far away, and in order to reach to the husband, the female feels that how could I reach to that because there is so much of distance, he is in other city, and that conflict is going on, and this female is not able to go from this particular place to the husband's place because of so many situations in the family. So here also the endometrium could shift to the outside of the uterus, or some new cells could be formed outside the uterus similar to the endometrium. Then fourth possibility is if the mother does not want any child because already 2-3 pregnancies or 2-3 children are there, the female does not want further child. So with this thought process also, the female can have endometriosis because she does not want any pregnancy. So the endometrium is shifted to the outside. Okay. Then rarest of the possibilities could be if the mother feels that I should bear all intelligent children, and so she wants an intelligent person or an intelligent father. So here also the thought process may induce endometrial cells outside the uterus. So friends, this is all about, this is something to think about regarding the conflict of endometriosis. But mind you, the site of the endometriosis also matters. Where is the endometrial tissue exactly located for that particular person? That conflict is different. So if it is on the ovaries, the conflict is different. If it is on the fallopian tube, this is different. So there are different things to think about in depth. So I would like to you people to think about all those situations when you are treating endometrial or endometriosis cases. So if at all you find any conflict, so please do share. And I would also be sharing my cases of endometriosis in my delusion series classes. So this class happened here on the last Sunday, and I hope the doctors and practitioners who joined that delusion series lecture class on Zoom, I hope they found it knowledgeable and some interesting points or some learning they received from me. So friends, please like and subscribe my channel as always, and again thank you all for giving all the love and affection. Thank you all.